Guys, it's Amanda, and it is day 4 of my attempt to bring true awareness to breast cancer, with October being Breast Cancer Awareness Month. And as you can see, I'm feeling a good bit better than I was the last time that I spoke with you guys. I am still feeling pretty crappy, but I got up and I was able to move around a good bit today. I was able to attempt to do my hair, though I didn't do the best job ever, and I was able to put some makeup on and feel a little bit human again. And while I was in the process of doing all of this, it got me to thinking about what breast cancer looks like. And so if you saw me now out and about at the grocery store, or even earlier this summer when I went to the beach on vacation, and at that time was in the middle of everything, and I even had one breast, you, from looking at me from the outside, wouldn't have any idea that I was in the middle of treatment for breast cancer. And part of that has to do with my age, of course. It's very, very rare that you would be diagnosed with breast cancer at 29. But it does happen. It happens every day, and it happens to much younger women than me. And of course, again, part of that has to do with the appearance of my still having my hair. I don't look like a breast cancer patient, because when you think of cancer, you think of chemotherapy and you think of hair loss. And I was not aware prior to my own diagnosis that over the last 10 years, they've gone a long way in developing tests that help you decide whether the risks versus benefits are worth chemotherapy for you. And that's something that we'll talk about later, but as you can see, I did not do chemo. I still have my hair. So yes, I'm young, yes, I still have hair, and I look very healthy. I do not look like I have or had breast cancer. Never really sure which one to say. But I look healthy, I look fine, I look like your normal, now 30-year-old. And even those girls my age who are currently in the middle of undergoing chemotherapy or radiation or very, very, very excruciating treatments, many of them also do not look like breast cancer patients. They look like your average 20-something-year-old. And a lot of that has to do with, again, technology's come a long way over the last several years. And one of the things that's changed are these things that you can wear during your chemotherapy treatments called penguin caps or cold caps, and they actually bring the temperature of your scalp down so low that the chemo doesn't get through the cells, and in some way, for a lot of people, it enables them to keep their hair. It doesn't work for some decide it's not worth it, but that is something that can be done nowadays. Another thing is cosmetics have come a long way with both eyelashes and eyebrows and makeup and all of these different things that make someone who may be right in the middle of chemo or some other excruciating treatment appear like they are completely healthy. And another thing, to consider is with breasts, breast cancer. A lot of us have lost our breast. And like I said, I did go to the beach this summer having only one breast. And most girls my age will undergo immediate reconstruction. And that's where they're going to, like I said before in the last video, put a tissue expander in and give you a little bit of your breast back. And over weeks, months, depending on what your treatment plan is, those will be enlarged over time, and you will appear to have normal breasts again. And then eventually, you'll have implants and have semi-normal looking breasts. So between the makeup and hair and breast reconstruction, 20-something-year-olds or 30-something-year-olds, we don't look like breast cancer patients, but we're out there every day. We're being diagnosed every day. And awareness, it's something that's real, and it's something that can, God forbid, happen to you, and it's something that we all need to check ourselves, be aware of what is normal for ourselves, and notice things that feel different, that are changes, and make sure that we push and advocate for ourselves to get those checked out. And again, I don't look like a breast cancer patient. I look like your normal 30-year-old. And it's not just breast cancer that can be deceiving like that. It's any mental illness and many physical illnesses as well. So we're all fighting some sort of battle. We're all fighting something any given day that those around us may know nothing about. And what can we do to make that better? I think that we can all be a little kinder, a little gentler to each other when someone appears to be having a bad day. You don't know what it is that they're going through, and it would make this world quite a better place if we were all a little more forgiving and a little kinder to each other, and understanding that none of us really know what those around us are actually going through. So again, day 4 of Breast Cancer Awareness Month, trying to bring some true awareness to what breast cancer can look like. And it can look like me. It can look like an average 30-year-old girl with hair and breasts and walking around. You wouldn't know. So breast cancer awareness, pay attention to what's normal for you. Get it checked out if there's anything abnormal, and always be your own advocate, because you are absolutely the best advocate that you could ever have for yourself. So, Breast Cancer Awareness Day 4.